Hey everybody, this is Tony.
And this is Paul, and we are headed out on the road for the Friends for Life podcast world tour. So let's hop in the car and get going. Making sure that individuals are reaching the goals they have set for themselves. That's one of the many goals of Assured Health Services. If you're looking for a residential care provider or searching for ADS services, Assured Health is your go-to place. Assured Health, helping others succeed. Learn more at assuredhealthohio.com or call 419-442-8066.
Dr. Craig Escude. It is very nice to meet you in person.
Same here.
Down here in beautiful New Orleans. Did I say it right?
You did. I was going to correct you if you said it wrong. Don't worry. I can promise you that.
New Orleans. And it's hot, but it is a beautiful city. And we're here to debut your new podcast. We are going to be going to a bunch of different conferences, disability conferences, and it is called IDD Health Matters. That name is very important for a lot of reasons. Why did you decide for that?
Well, because we're talking about IDD health issues related to health and wellness in people with intellectual and developmental disabilities. But IDD health matters. Yeah. It makes a difference in people's lives in all aspects of their lives. When you think about it, if you don't have your health, you can't work. Mm-hmm. You can't enjoy activities in life. You can't be integrated into the community. So it's really important. IDD health matters. It makes a big difference in all of our lives. Health matters in general.
So this is coming off of the show you used to run, Medical Mondays, which I really loved that show because it taught me a lot about the health field and how it interacts with people with disabilities and some of the flaws in the system, which I think it's good to point out sometimes. But we wanted to take this in a new direction because you interface with health professionals often. You go to a lot of conferences. We're at a conference right now. And what was your vision? Why did you want to go this route with the show?
Well, I think that it's important, well, a couple of things. One, to dispel a myth, which is important for us to talk about. So I'm going to talk about that first, and then I'll tell you why we're doing it.
The Reliable Drug and Alcohol Testing Clinic is a leading provider and convenient source of pre-employment and occupational type testing. Their clinic provides services to a wide range of private businesses, healthcare facilities, and municipal and county courts. Reliable is an independent, locally owned clinic. As a result, they provide their services at a lower cost than the major hospitals, have faster turnaround times on test results, and eliminate the long waits typically incurred at these larger facilities. To learn more, visit reliabledrugtest.com.
So there's a common myth in this field that I want to dispel, which will lead into why I want to do this talk. And there's a term that you hear in this field, and it's called the medical model. Mm-hmm. And it has a very negative connotation, and rightfully so. It was a model that health professionals had of people with disabilities in the early 1900s and middle 1900s, really not that long ago, where people with intellectual and developmental disabilities had a medical problem that needed to be fixed, that they were messed up, they were broken, whatever it was. And that was the mindset. And what has happened is we now have the social model, which looks at people with intellectual and developmental disabilities and neurodevelopmental disabilities as a variation of everyone else. And instead of fixing those issues, the environment, the support network, the support system should adapt to have accessibility for everything, including health, for people with intellectual and developmental disabilities. And that's one of the things I want to make really clear about this, since we're talking about health, is this is not the medical model. This is not trying to fix the disability. It is, what it really is I recognize, and I learned this firsthand in my own experiences of being ill-prepared to provide healthcare for people with intellectual and developmental disabilities. We need to improve the healthcare system and the world of supports and services in general, especially relating to health and wellness, so that people with IDD can have access to the same level of healthcare that all the rest of us do. And that does not exist right now. That's why I want to talk about these issues, because I want to raise awareness of the importance of health and wellness in people with intellectual and developmental disabilities, call attention that yes, there have been some improvements, but we've got a ways to go.
Yeah.
We have a lot of things that can be done. And what we're going to do on this show is we're going to talk to leaders in this field all over the country, maybe even all over the world at some point. How about that? And hear what they have to say about health, general supports and services for people with IDD. I don't want to focus on the issues. I want to talk about what's happening in this field. And there's a lot happening. There are a lot of people working to improve supports and services in health and wellness in this field. So that's why we're doing this show, and that's what it's all about.
Well, I think that's really great. And that is part of what we wanted to do as Friends for Life is raise awareness about this stuff, because as someone who came into this field as an outsider, disabilities are not talked about. Outside of the world in which everybody lives in, where you're talking about your county boards and going to the doctor's offices, and it's always been this viewed thing as it's a problem that needs to be fixed. And as you just stated, it's not a problem. It is a part of life. All the way from fish to humans, there's always a disability of some sort, and there's nothing wrong with that.
And let me just add this. So we're talking about IDD, intellectual and developmental disabilities, but this relates to disabilities in general. And there is actually a fair chance that most of us could end up in a similar situation.
Yeah.
An injury, an accident, a health issue, some medical problem, a stroke or whatever, can dramatically change our lives. And then we might be in a position where we might not be able to communicate some of our health issues. And if clinicians aren't trained to understand and recognize health issues in people that can't tell you exactly what they're feeling. Oh, my stomach hurts and my head hurts, and these are the symptoms I'm having. That can affect all of us. Yeah. None of us are that far away from being in a debilitated position. So what we do in this field helps everyone.
Yeah, and that's something that I think a lot of people take for granted. And another point that you brought up that I think is really important is medicine is starting to be viewed more as a social thing. And I went to school for cultural anthropology, and that's something we actually learned about is there was all these studies done with native tribes and having to go into the modern medical world if they got sick and they needed medical treatment. Said sometimes the medical treatment wasn't effective because they didn't tie in their spiritual belief into, for them, that's their whole life. That's the whole way that they view the world, is through this model of spirituality and this. And if the medical system didn't have that, which, I'm not saying it has to all the time, but it wasn't effective just because your mind is so powerful. And I think that's a great way to think about it, because, again, we're not fixing people. We're just making sure that they have better lives to the best of our abilities.
That's exactly right. When you're talking about the mind aspect of things, that's actually another movement that's very important actually to this field is integrated care, integrated health care. We have siloed mental health and physical health. So you go to the physical health doctor for physical health needs, and then you go to a psychiatrist or a psychologist for mental health needs. And for a long time, those two didn't necessarily even talk. But we all know how much our mind affects our bodies. And when our bodies are not doing well, it affects our mind and our mental state. They are tied together. They are not separated. But we have separated that a lot in healthcare. And especially for people with intellectual and developmental disabilities, it is so important to move towards an integrated health care model where we have mental health clinicians working with medical and physical health clinicians and putting those two things together. Because in this field, so many things are interrelated and intertwined. And that's what happens a lot of times is you'll have a person who with a disability who does not communicate using words, but yet they still very much can communicate what's going on. So they may have some adverse behavior that is causing them to be agitated and hit people or refuse meals or throw their plates on the ground when somebody tries to feed them. And what we often think, or what many people might think, is that, well, this person is having aggressive behavior and this is a mental health issue and they need to be put on some sort of medication to treat that. What might actually be happening is they might, say, have a bad tooth and it hurts every time they chew, but the only way that they can communicate this is somebody tries to feed them or help them eat, and then they hit the food and throw it away, hit it away because they're going to have pain. And so that's why it's even more important in this field to have that integration between mind health and physical health and understand those relationships. And this benefits everybody. It should be this way in all of healthcare. And we're moving towards those things. And again, that's what I want to focus on in this podcast is what's actually happening. What are some of the good things we're seeing and some of the directions that we want to go towards?
Yeah, and I think this is a great addition to what we've already been doing. I mean, Medical Mondays was very informative. That was a great show.
Thank you.
But there's something missing when you're talking by yourself, that conversational piece.
It was lonely out there.
It's lonely at the top.
Well, it's lonely on the top of my little mountain ridge where I live. So,
but I think this is very great because not only are you getting to have conversation, but you're going to be having conversations with some of the best in the world in this field, which is important because they also are only talking normally to the other best in the world in this field, which is good. That needs to happen. These conversations need to have to grow the learning process. But nobody out in the internet abyss or the world knows a lot about this information. I am so glad that you're trying to get that message out there because especially in the medical world, you guys are busy. You doctors are busy. And to have this information out there to maybe change some people's perspective on this is important.
Well, that's another great point. All of the people who understand, and we actually, this comes up in some of our meetings and conversations that we have when we're problem solving or talking about different issues is, well, all of us here in this room or now in this Zoom, all of us here get this. Mm-hmm. We need to get this out to other people, to the bigger world, to the world outside of this field. And you started off, when we first started off talking, you mentioned how, if you're not involved in this world, you don't know about it and you don't really have a need to know about it. And I was just like that. I went to medical school. I didn't know anything about this field. I wasn't taught about this field or this area of practice. And when I started working in this field, I kind of fell into it. And there are kind of two ways people get involved in this field. One of them is they fall into it. The other one is they have a family member or a loved one with a disability, and they become advocates for that person. And they've worked through the challenges of the system in trying to access supports and services, including healthcare services, and recognize the challenges, and then they want to do something about it and work in it. I fell into it. And I quickly learned how little I understood about this. But that kind of got me started. And it's like, okay, I've got to learn this, and this is important. And then down the road, years later, after I learned a tremendous amount from nurses who had worked in this field for years, from direct support professionals who worked in this field, from people with disabilities themselves that I was taking care of, there came a point where we were looking to move more people into more integrated settings, into community settings, and out and away from larger congregate settings. A lot of great benefits for that, but a lot of challenges. And if you don't address the challenges, then you're putting people into a situation where they can actually be worse off. Yeah. And that was my concern because I knew what I didn't know as a physician. I knew what I didn't. I learned that really quickly, and I learned a lot. And then when we were saying, okay, we're going to start moving people into community settings, and they're just going to go to the community doctor and get their health care there. And my first thought was, literally, people are going to die. Because they're going to be looking to get their health care from clinicians who had the same training I did. Zero.
Yeah.
And that's what really lit a fire under me. I'm like, I've got to do something about this because people that I have developed relationships that are my patients that I've been taking care of, that I know when they twitch their eye a certain way that it can mean that this or that issue and this is how we treat it. I need to do something to try to provide some sort of training and education about this field to clinicians so that as people move into community settings, they can have access to competent healthcare. And that is not, again, the medical model. That is health equity. That is making sure that anyone who goes into any physician's office, into any hospital, into any emergency department can expect to have a basic level of competent healthcare. And everyone should have that.
And that's essentially what you're doing with intellectability. That's what you were doing. So for people who don't know, we had you on the podcast a very long time ago at this point, and we haven't really caught up. You were kind of going through the name change at the time, and now you're fully invested in that, and it's intellectability now. What do you offer to training wise to other people in the field? I mean, they can go back and watch Medical Mondays and see a lot, but just for the new listeners, maybe.
Yeah, sure. So our company, first of all, I decided to leave my clinical practice and work with this company because what I was trying to do as an individual was very much in line with what our company was doing, and it was just such a natural fit, and I couldn't be happier, frankly. Our company is based on something called the health risk screening tool. It's a web-based tool that screens for health risks in people with intellectual and developmental disabilities. But what the cool part is that it also provides action steps based on those health risks that are identified that supporters can take to reduce those health risks and to improve quality of life for people. And so this tool's roots go back to the early 90s, 1992. Our company founder, Karen Green McGowan, who's a nurse in this field, developed the tool without going into all of the history, which is pretty interesting and extensive. The tool is now used to screen for health risks in over 93,000 people throughout the country. It's used in 26 different states. There are some states that use it statewide across the waiver population, people who receive waiver supports and services. And that's the foundation of our company, which was called Health Risk Screening, for the Health Risk Screening tool. And we have expanded. We've expanded our services into some other divisions, and we felt we needed a name that really, first of all, tied us to the field. Yep. And secondly, that would be the umbrella for our other service divisions. So we worked really hard with a consultant and agreed upon the name Intellectability. And if you take the term intellectual and developmental disabilities and you cut out all the middle, you get intellectability. Yeah. It ties us to the field and it focuses on abilities and the positive things. Okay? So that's our company name, that's our company brand. Underneath that, we have 3 divisions, or 3 service brands. We have the Health Risk Screening Tool division, which I just mentioned. Our Academy division is our second division. So as a result of what we were doing with the Health Risk Screening Tool, we were asked to develop training and courses to help supporters who, if you think physicians didn't have a lot of training in this field, imagine a direct support professional coming in who's responsible for a million things, including monitoring for health and wellness, health destabilizations, early signs of an illness. So we were asked to develop some training courses to help direct support professionals, nurses, people who work in the field, to understand or to be able to recognize some of the bigger health issues. We call this the Fatal 5, the top 5, or Fatal 5 Plus is what we do because there's an extra one in there now.
I remember from Medical Monday.
There you go. But these are the top causes of preventable illness and death in people with intellectual and developmental disabilities. So we have that particular e-learn course. We have a number of other ones that deal with choking, that deal with physical and nutritional supports. And the one that I have to say I'm a little more tied to and a little proud of is the one that I specifically worked on. It's called the Curriculum in IDD Healthcare. It is specifically designed to train practicing clinicians and medical students and nursing students and other health professional students about the fundamentals of IDD healthcare. It's a 6-module course that is currently being used in medical and nursing schools, nurse practitioner schools, as well as practicing clinicians throughout the country to learn the fundamentals. And that was a very organically derived course. I told you back when I was working at the ICF in Mississippi, the Intermediate Care Facility, and people were moving out to the community, I'm like, we've got to do something. So I started a program called Detect in the state to provide education and training and clinical support to clinicians in the state. And I'm like, I've got to get out there in front of them and start talking to them about these issues. So I figured out, okay, what are the most important things they need to learn and that I can teach them in 1 hour? And then I got asked to come back after they were like, wow, we didn't know this stuff, which is a very common thing. But we recognize we need to learn it. So they're like, you need to come back to the next conference. So I said, okay, what's the next thing I need to teach them. And that's how the curriculum in IDD Healthcare was developed. So it's 6 modules. It's an e-learning course that's out there to teach clinicians about health and wellness. So there's that aspect. And then our third aspect is, our third service brand is the person-centered services brand. And that is really important in terms of really looking at this and saying, okay, it's all medical. Is it too medical? Are we too medical? Well, we've got person-centered services, and we do person-centered training to help make sure that we not only, all of us who work in this field, don't only support people and do things that we think are good for them, but they actually have a say in their lives. Mm-hmm. And we need to be able to learn techniques and skills, and there are actual skills that you can learn to help figure out what's important to someone who may not be able to tell you verbally.
Yeah.
And so we teach those things as well too, and it really gives a nice balance between the health, which is typically a little heavy on what's best for the person, because most people don't think, I can't wait to go get my annual screening colonoscopy or whatever it is. Most people aren't looking forward to that. So it's more what's important for, but we need to balance that with what's important to the person. So that's kind of who we are and what intellectability is.
Yeah, and I think that's really important. I mean, I say this a lot. I'm a big fan of disruptors, people who disrupt the industry, because it's so important for positive change, because things get stagnant very quickly. And in my opinion, the whole DD world in general needs a rebrand, because coming into this, I was so overwhelmed. Even we have guests on from every aspect of the field on the Friends for Life podcast, and it is just term after term after phrase after, and I'm just it would take a lifetime to learn this, and you expect a DSP who's barely making more than minimum wage to understand all of this stuff, and it's tough. So yeah, it's very difficult, and that's kind of what we're fighting for, is trying to get these people. They're working very hard, and it is insane how hard they're working, and we're trying to get the state to wake up and be like, hello, please pay these people what they should be getting paid.
Yeah. I couldn't agree. And that's one of the reasons there's such a high turnover in this field, because you're asking people to be responsible in a lot of ways for people's lives, and sometimes work in an environment that's pretty challenging. But what we want to show on this podcast and in all of what we're doing together and what you are doing is there's a lot of positive things in this field. And while, there are certainly money challenges, and pay does definitely needs to be increased, there are a lot of, this is a good field to be in, and you can do a lot of good, and there's a lot of room for people to do good, and there's a lot of room for people who are innovators and thinkers and that can bring in different skill sets and use what they do to impact people's lives. And we want to focus on those things and help people recognize that this is not a job. This is a career, and there is a career path in this field. And I'll give you a perfect example. The person who became, when I was working in Mississippi with the state, I was working for the state there in the agency. And when I was there, the person who was the executive director of the Department of Mental Health started as a direct support professional 30 years before.
Yeah, that's amazing.
So yeah, it can be done.
I have a perfect example. I'm a podcaster in the DD world. Come on. There's every opportunity in this field that there is in any other field in the world. It's just you need to be innovative, and you need to think outside the box.
That's right.
Make it a reality. So, well, I think we're ready to wrap up here. You got a bunch of guests coming through here today, which I'm excited to hear, and I'm excited to watch you in your arena, because I'm always in my arena. It gets boring in there sometimes. So when you do the same thing, I'm excited to see what you have to learn. You want to test out your game show here? I know you had a game show you wanted to try.
Oh boy, I did have a game show. So
I can be your first subject, and we'll see how it goes. I don't know what I have to offer in your realm.
Okay, so you want me to ask the question? I thought you were going to ask me the question. Okay, good. I feel better now.
No, you ask me.
All right, so we're going to do this. We're calling it 3 and 3. All right, so I'm going to set my trusty little timer. And you can't go over, and if you go under too much, I'm going to make you talk more. So I want you've got 3 minutes to talk about 3 things that you think should happen, could happen, might happening, it might happen, is happening, related to improving health, wellness, support services, relating to improving the lives of people that we touch in this field.
Perfect.
All right? Okay. All right, so ready?
I'm as ready as I'm going to be.
Here we go. All right.
All right, 3 things that are improving. We'll start there. I have seen so much push for self-advocacy in the field, which I think is amazing because as someone who talks about this stuff all the time, we do a lot of talking for other people, and I think people need to talk for themselves because I'm not going to get as passionate as the person who is having to deal with the system. We met a lady on one of the podcasts we did in Ohio. She was in a wheelchair. She told the story about how she had to fly to DC, all these problems at the airport, no support at ever. And by the time she got there to talk to the legislature, whoever's over there, she was mad. And I was like, that's amazing because you're the person who they can see that you have a disability, and then you get to go in there and tell them what that's like. So self-advocacy is something that we've been seeing a lot more push towards, and not speaking for someone. There's a difference between speaking with someone and helping to interpret if they have a hard time talking. There's a difference in that and speaking for them.
You're exactly right. And you know the phrase, nothing about us without us.
Yes.
Yeah. So that relates to that.
Biggest one, in my opinion. Number 2, the thing that we've been seeing a lot. I got time here. Number 2, the biggest thing that we've been seeing is a push for not only businesses, but nonprofits and individuals going to their local representatives and being like, hey, we are tired of this. And there is an actual push out there from CEOs down to DSPs, down to people that are receiving services, going out and being activists, not just like arguing into the internet like we can be pretty guilty of ourselves at the French Life. We're going out there and actively making things better for themselves all the way up the ladder. And I think that's amazing. And there's really important people. I don't know why Ohio is the epicenter of disability stuff, it seems like, for a lot of times, but it's really amazing. And third, better.
What would you encourage for your third thing people out there to do, people that are listening to us?
Listen to Dr. Craig Escude's podcast. That would be the best thing you could do to learn more.
All right, what a plug there. Thank you.
Well, no, this has been fun. I'm very excited for your show. I think this new direction is going to be amazing. And the rest of the day is all you, my friend. You got some really awesome people coming through, and I'm excited to hear what you have to say.
All right, appreciate it, and look forward to doing this more with you and the group and everyone else out there.
THS Remote Supports is clearly focused on improving independent living through dynamic and personalized services. Their systems have been carefully developed and perfected to ensure that everyone receives the best care through the least intrusive means possible. Located in Cincinnati, Ohio, they've spent over 20 years providing in-home supports to individuals with disabilities. If you or someone you know is looking for a remote service provider, go to thsrss.com or call 513-882-9088.